the people who are joining in. I welcome you all for this particular Ayurpreneur Mastermind session. And I could see a good, amidst the great personalities there. Good morning, Dr. MDP Raja, sir. I'm happy to see you being in my presentation, and I believe that you will give some insights at the end of the session by going through, because you are a very well-known, a well-renowned practitioner in Hyderabad, and you have created your own blue ocean. Okay, you are the true example. You are true example for the blue ocean creation. Okay, so I'll be happy, and our participants will be happy to hear you at the end of the session, if time permits, and if you are there at the end till then. So let me let me share my screen once again and go to the actual presentation, because I would like to keep it very crisp and this one, so that we will not be will not be missing our Sunday, what you call the enjoyment. You may be, because I thank all of you leaving behind your Sunday, that leisure time you invested, you are coming here to invest and learning, and I appreciate your particular what you call this which will definitely help all our Ayurveda community members to motivate each other and grow together. Okay, so coming back to the blue ocean, okay, I call it as the 30 minutes blue ocean strategy, and I'll try to explain it all and give you the strategy within 30 minutes, how we can understand our own blue ocean, where we have to start, what exactly we can work on to make our own, our particular competency, our own professional, what you call the branding can stand out of the market. By that, you can be beating the competition, and you will be creating your own, what you call the scaling up business in the Ayurveda. Okay, so that is what a blue ocean strategy is. The problem, why see, the session will go through this, what you call the 5 sections. We'll identify the problem, we'll find out the solutions, we'll make the strategy how to deal with that problem and how to implement those solutions, and what will be the outcomes, and at the end we'll conclude with the what you call the highlighting points, and of course acknowledgement, because whatever I am doing, I am getting it from the different books, different learnings, different mentoring programs, and I would like to acknowledge them. Okay, so the problem, all of you are, because already the senior people are there in the session, and I believe that you all are aware the biggest problem with us is, even though we are competent enough to practice Ayurveda and more competent enough to practice allopathic medicine. Okay, so because of that, the problem with us is, as we are more competent with practicing allopathy medicine, we are neglecting our own Ayurvedic medicine and its particular, what you call the benefits and the opportunities to create our own blue ocean. Okay, and we are shifting towards 95% of our graduates, they shift towards the allopathic medical practice. But unfortunately, the problem with them is, now we are finding the difficulty that there are the legal problems and they live in the legal insecurities. Okay, most of the people who are practicing allopathic medicine, okay, in many of the states, it is happening that they are facing some legal problems, and because that they are in the phobia, continuous, they are living in legal phobia as well as the legal issues. So, for example, in Gujarat, recently, the paper article has appeared where all our Ayurveda community members, along with what you call the their association, our own association, we have made a representation to the what you call the bureaucrats or the authorities, where we were requesting them to allow the Ayurveda doctors to practice allopathy medicine, because there was the cases have been registered against the Ayurveda graduates who are practicing allopathy medicine in the Gujarat, as well as many of them, they were made, means their clinics were seized, and they were issued a legal notice, as well as they were arrested. So because of that, the movement has started, and the people are approaching the authorities, concerned authorities, to take out that particular legal actions, what means remove those legal actions, whatever they're taking against the graduates. But unfortunately, there is no what you call the permanent remedy for it. Okay, the same issues are with what you call the Madhya Pradesh. It has gone ahead. The Madhya Pradesh authority especially the Chindwara district authority has issued notice to all the registered allopathic medical hospitals, nursing homes, that they are not supposed to take BMS as well as BMS graduates as their duty doctors or intensive care unit doctors, or the surgical ward doctors. See, the duty doctors, what it has suggested is that these all the establishments are only allowed to take MBBS doctor as their junior doctors or resident doctors to take care of their patients. So you can understand the what we call the impact of the problem now. Okay, so it's earlier the certain things were happening, and here and there some the issues were noticed, but not an official notices like this. These were not appearing. So the situation, the scenario is changing now. The government is also looking, and they are coming up with such notices which are making the what to call the issues more what to call the uh, more what to call serious. So we are supposed to think now in a in understanding the future threat what all our Ayurveda graduates are they are having. So it is a high time to look into these problems and find the solution. And even in Karnataka, okay, the government of Karnataka has issued means it has given the authority to use allopathic medicines for its Ayush doctors who are appointed in the primary health centers. But now this notification has made, which is telling that whatever the power was given to the Ayush doctors to use allopathic medicine, that has been withdrawn, even in their primary health centers and the government, what you call the health establishments. So the government has taken it back, the authority what it has given earlier to prescribe allopathic medicine by the Ayush doctors to the patients who are coming into their particular government establishments, healthcare establishments, but it has been taken out now. So now you can understand the problem. Okay, isn't it? This is a problem. So unless we address this problem, we are going to live in this legal phobia, legal issues, and by that we'll be finding difficulty to live our what you call the abundant lifestyle. The second biggest problem is that we are in the red ocean. We are not pursuing it. We are not understanding it. What do you know red ocean? Red ocean is the opportunities are less, competition is more. Okay, the opportunities are less and competition is more. That is a red ocean because already the big sharks are there. So as per me, even though I am a Ayurvedic surgeon, I practice integrated medical practice. Even post-operatively, I use antibiotics. We use anesthesia for the surgeries. But I am trying to shift my particular what you call practice to more of what you call the Ayurvedic medicine. I am integrating it in such a way that 60 to 70% is Ayurvedic medicine, 30% wherever we are not having, which is inevitable to use allopathy medicine, there I am using allopathy medicine. By that, I am trying to create my own blue ocean. I am coming out, I am trying to come out of this red ocean. But unfortunately, it's not it is not possible with our own friends, Ayurveda graduates who are practicing purely allopathic general practice. Allopathic general practice, because they are in the red ocean. It is inevitable for them. Already they are into the allopathic general practice. They are doing that what you call day-to-day symptomatic treatment, and they are writing the medicines. And unfortunately, they are in the red ocean where the big sharks are already existing. Like allopathic super specialists are there, allopathic specialists are there. Ayurveda, our own people, colleagues are there who are also practicing the same allopathic medicine. They are writing the same medicine, and homeopathy and other professionals are there. Alternative medicine people, they are also into this only. They are also writing allopathic medicines. And above all, we have got non-medicos, whom we call as compounders, who worked under some doctor as a compounder, as an assistant, as an attender, and they are also coming with their own that acquired knowledge of prescribing allopathic medicine, because it is very easy to prescribe symptomatically. I believe that you people are understanding this. What is red ocean? This is red ocean. When you are in the pool of the competitors, where your share is going to be very less. Because the whatever available share is there, that is supposed to be taken by all the competitors, and the big sharks will have their own bigger bite of that share, and the small sharks will get the smaller one. and you are a fish there because you are not being protected legally also. So you cannot be a shark. You cannot dominate that field. You need to stay underdog. And this is the problem. And unfortunately, we are not realizing that problem. We are supposed to, even though wherever you are, whether you are novice, just starting of your BMS, after means you are in a BMS student, if you are starting up, completed the BMS and you are planning to open your clinic, or you are a practitioner since 10 years, 20 years, whatever, now it is time, if you are into that allopathic medical practice, it is time to, either if you are senior more, you are already spent your 15 to 20 years in the allopathic practice, you need to integrate. You need to shift your particular, what you call the solutions, or the remedies or the offerings what you are having for your patients into 70-30. 70-30. 70% you need to incorporate Ayurveda medicines, and 30%, as you have already gained that knowledge in the allopathic medicine, and where you can, wherever the acute diseases are there, you can use the allopathic medicine, and whenever chronic diseases are there, you can go with the Ayurvedic medicine. By that, you will be creating your own blue ocean. You will not be bothered about the future what you call the competition, as well as the legal problems. So at least you can proudly say that you are an integrated medical practitioner with 70% of Ayurveda and 30% of allopathy for acute conditions, and chronic diseases you are treating with allopathy Ayurvedic medicines. So I believe that now you people could understand what is the problem, and why I am more stressing on this allopathic cross medical practice is, the one is the legal problem. Second is, even though, okay, if let it be legal problems, but if it have been what abundant opportunities would have been there, then it's okay. But unfortunately, along with the legal problems, we are also in the red ocean. The less opportunities and what you call more risks, maximum risk and minimum benefit. Because of that, most of us, we live the mediocre lifestyle. We live a mediocre lifestyle. Isn't it? How many of you agree with me? We live a mediocre lifestyle. No social and professional significance. Even though you are doing all the best of what you can do, you are providing 24/7 services, but still you do not get that the same significance, same respect as in our contemporary people they get in the society. Okay, and no financial abundance. You may get wealthy over the period by practicing allopathic medicine. You may get wealthy, but are you really rich? The rich is when you get freedom, time freedom, and financial freedom to do whatever you want to do, whenever you want to do, how many times you want to do, and with whom you want to do. Where you are able to get behind, nurture your passions. That is what the rich means. So our aim should be to get rich, not the wealthy. Wealthy, anybody can become wealthy, but at the cost of investing their physical presence, losing the time freedom, and because of that, you will not be living what you call the abundant lifestyle. And no time freedom, as I told you, no time freedom, because you may suffer, because that lack of time freedom, you may suffer with compromised self-health and reduced lifespan. We are supposed to live 100 years, and unfortunately, we may not live that because of this lack of time to take care of ourselves. Lack of time, family time. There is no quality time with the family, because you are supposed to be in your clinic 24/7 to accumulate that wealth, what you are looking for. Compromise personal life. As I told you, you are not able to take care of, live your passions and hobbies. And compromise social life, you may be having social less connectivity. So when all this, everything is compromised, and such a big problem is there, and unfortunately, still we are into the same red ocean. Still we are living in that particular mediocre lifestyle. So what is the solution now? So solution is, you can have two solutions. You can have two solutions. One is struggling to overcome the challenges being in the red ocean. If you do not want to come out of it, you do not want to take chance, you do not want to challenge yourself, you do not want to learn new things. If you want to live in that comfort zone, that is, you'll be living in the red ocean if you are an allopathic general practitioner. purely allopathy general practitioner, you will be living in the red ocean. Okay, that is also there. You will be surviving. There is no issue of surviving. But unfortunately, you will be gifted with more stress and more investment of resources because you need to compete with your bigger sharks. So that will give you more stress because every day there is a competition. Every day there is a competition. Every moment you subconsciously will be feeling that competition. Because of that, your cortisol secretions will be going high. Your stress hormone will be going high. So once your stress hormones are going high, faster aging is there and lot of anxiety is there. Faster aging, you will achieve premature senility, which may indicate which may lead to reduced productivity, Okay, so this is, see, the perspective of the life, how you look is depends upon you, what really matters for you. But if you listen to the most richest person in the world, everybody will say that being rich is better than being wealthy. Having accomplishment of the life is required rather than only making money. Or like not living your 100 years is itself is a biggest loss what you are facing. And the anxiety is which is going to cause you that all that what you call your agility, reduced agility and reduced enthusiasm and reduced wisdom and loss of memory, as well as what you call error making decisions. Okay, error decisions. So all these negative effects will be there, even though you may be making, you are struggling in your red ocean, and that is the one solution if you still want to go with that. Okay, I'm not saying that immediately you should close down your allopathic general practice and come to Ayurveda. No, over the period you should try to understand what better you can incorporate along with your running practice from the Ayurveda, and by that you will be, over the period you'll be creating your own blue ocean and you'll be shifting from settler position to the pioneer. Because the blue ocean is how if you want to create your blue ocean, you need to shift from settler position to migrator to the pioneer stage. That is what you are required to do. Okay, and more investment, because you ultimately you will be investing your physical presence there, your energy there, and at the same time more financial investment it may be required when it comes to competing with your competitors over the period. You need to upgrade your infrastructures, you need to increase your marketing and branding, investing on that. You need to have costlier equipments and instruments, and some inevitable additions you are forced to do, because again it requires investment. That is your own dispensary or your own lab services, again with the legal, attracting the legal issues, because the doctor cannot have his own dispensary. Of course, you need to find the person who has got the QP, and always you need to be under his particular mercy. Okay, so value cost trade-off. Value cost trade-off means what? You are going to compete with your competitors by reducing your price. Because see, if you are giving the same thing what your competitor is giving, ultimately there it starts the what you call the cost trade. Okay, that's competition starts. So if the person who is writing the same medicine, if he's charging 100 rupees, you need to reduce your charge to attract the crowd. That is what we call, and by that you will be reducing the value what you can provide to the patients. And that is what you are getting into a red ocean, a bleeding competition, where you are going to trapped into that value cost trade off. So as per the cost, the value will be there. So if the cost is low, automatically your value addition will be less, because you need to cater more patients in the given time. Because all of us are having the same time, 24 hours, and within that period, if you want to earn more, if you reduce the value, if you need to reduce your consultation fees, you need to increase the number of patients, and by that you need to invest your physical energy, your mental energy, and if you want to accommodate all of them in the same time period, automatically your evaluation of the patient, your treatment planning, decision making capacity, everything goes down. And that may compromise the value what you were earlier adding to your patients. And when you get trapped into the trade off, value cost trade off, you are going to reduce it, and vicious cycle will start, and that will affect on the result what your patients are getting. When the patients are not getting result, the number of patients goes down again you will be reducing your price, believing that your competitor has increased the means the number of your customers has gone to shifted to your competitor, and you will be in that benchmarking his particular pricing, you will be reducing still more pricing, and by that you will be into this trade off, what you call the competition, value cost trade off competition. Okay. The second solution what you can have is creating more peaceful and abundant blue ocean. Okay, more peaceful. What this session is intended to giving you the insight is, we are proposing, Ayurpreneur Academy is proposing this, creating more peaceful and abundant blue ocean, not struggling into the red ocean. Okay, so what is the blue ocean is? Blue ocean strategy is not about only technology innovation. That is a good thing what we are Ayurveda doctors we can welcome. Okay, as Ayurveda doctors, what we can welcome is good thing is that to create a blue ocean strategy, it need not require all the time the technology. So we need not to bother that we are age-old medicine people, so we don't have technology. It is all about value innovation. If you are able to create value, okay, and you are going to modify that, if you are going to offer that value in a more, what you call the innovative way, what you are getting from the Ayurveda to the patients, you are creating that value innovation. And that is what blue ocean strategy is. Blue ocean strategy is value innovation, not the only technology innovation. Technology innovation, it is a trending. Today, the technology is ever changing. You cannot be with that. You cannot create a blue ocean, permanent blue ocean. Of course, blue ocean cannot be permanent, but still, compared to red ocean, blue ocean happens to be for longer period. It can give you abundant lifestyle for longer period. It can keep you out of the competition for longer period, because you are making value innovation. And you are fortunate enough to be Ayurveda doctor, because each and every verse of our classic will give you idea how to add value and how to make value innovation to give result to the patients. Okay, so ultimately, when you're creating a value innovation, one thing we need to remember is we are supposed to align the three propositions. The three propositions are, okay, value proposition means value to the patient, your customers, your buyers, whatever yours, and profit proposition for both you as well as the patient or your customers, and people proposition, how to attract the people, how to make the people to understand that you have got the better value to add for their life. Okay, so the value proposition, just a minute. So value proposition is best remedy for patient's problems. That is value proposition. If you are able to give best remedies for the patient's problems, that is what you are going to align the value proposition for the patients. Okay, and profit proposition is offering Ayurveda remedies. You can have, by that you can have better profit margin. See, if you have got or a Shamanaushadi, and that is only available with you, and you are the one pioneer of that, your own formulary, you can offer a well deserving price for the patients. By that, even the cost for you, okay, pricing is for the customers. So the cost, if you at a very minimal cost, if you are able to give a better value, okay, at better value, means the medicine what you are preparing, it requires very minimal value cost, but when it gives a better value, the people are ready to pay whatever you demand. Okay, so for example, as Dr. MDP Raja sir is in the session, I believe that MDP Raja sir is using all the Ayurveda remedies, and wherever he is using Ayurveda remedies, maybe Kshara Sutra or Kshara Karma or Agni Karma, whatever for the piles patient, the people will be happy to pay him lot of means the equivalent or more than the what the modern surgeon is charging for an hemorrhoidectomy. Yes or not, sir? MD Pira, yes, sir. You can put it in chat box. If my predictions are correct, if my assumptions are correct, MD pressure can be given, means patients are ready to give, because patients are, they don't want recurrence. Second is they don't want the painful surgery, and third is they don't want, they want to be, means they want to be free from that fear, because whenever they go to allopathic surgeon, they are not so much aligned with them, and moreover the fear of losing the continence, which has been wrongly misfitted in the wrongly fitted into the brain of the means minds of the of general public, will make them to come to Ayurveda surgeons. And by that we can offer, and how much it will cost for us. One Kshar Sutra, even if you buy, it will cost 150 rupees for 12-inch length. And you can charge 25,000 rupees, which is the biggest profit margin which ever but anybody can imagine. The same with even Shamnosri, so the same with Panchakarma. Okay, ultimately, the patient is free from the what you call surgical interventions if you are using Ayurveda medicines, especially when the classics are also proposing non-surgical medical management for surgical disease or chronic disease or autoimmune disease, where the patients can be free from all those surgical, maybe surgical intervention, or maybe some what you call the chemical intervention like allopathic medicines, and organic, more natural way, and lifestyle changes, and patients are happy to pay, and the patients are also winning. They are also winning because they are free from all that hospitalization. They're free from all that agony, pain, what they are supposed to go through, the whatever the chemical, whatever drug reactions. And at the end, the what you call the, even with autoimmune disease, there's no permanent remedy from allopathy side also. So there, if you are giving them the better value, it will be win-win policy for both you as well as the patient, and at the same time, it will be offering you a greater profit margin. What will be proposing, okay, proposition is with the profit margin. And people, okay, people proposition is attracting more patients by highlighting non-surgical parasurgical remedies for the present assumptions of the surgical disease. Like for example, I see BPH, okay, the busted treatment in BPH is proposed in our classics. Of course, Mutra Stila, many of us we compare it to the BPH, and in for all the Mutra Gata, whatever you see, which we call it as obstructive, what you call the uh, bladder outflow obstructive diseases. Okay, obstructive out what you call the outlet obstructive disease. Okay, so if you compare Mutra Stila with BPH, in BPH, the assumption is that the 90% of the urologist, they suggest TURP whenever the prostate is, it goes beyond third stage, third degree. Okay, third degree. Third degree. Okay, so if our Basti treatment can take out that surgical intervention, and if you are able to educate this to the patient, and if you are able to give the result, okay, through Basti for prostate enlargement without surgery, that is how you are going to align the people proposition. Okay, people proposition. So by these three, you can easily create your own blue ocean of using Ayurveda, so that you will be standing out in the market. And by that, you'll be having the second solution, that is creating your own peaceful, abundant blue ocean. Now, what is the strategy then? So strategy is simple. The four-step strategy is there. Four-step strategy is there. That is reconstructing market boundaries. We are supposed to reconstruct our market because it is very much needed. We are supposed to reconstruct our market because we need to come out of that allopathic or mindset, and we have to use Ayurveda mindset. That is how you are going to reconstruct the market. You are going to reconstruct the market boundaries. Okay, you are going to reconstruct the market boundaries and focusing on the big picture, not the number. Even if you can treat 2 patients per day, but you can earn in thousands or lakhs, and not against the people who are seeing 50 to 100 patients per day, and they are still not matching your income. That is, they are looking at the number. not in the big picture, and reaching beyond the existing demand. So we need to reach beyond that existing demand is there. So the existing demand is that you are treating general complaints. Okay, you are a general practitioner and you are treating the existing demand. You need to think what beyond this I can do. How I can create my blue ocean, how what disease which are not falling on this regular what you call the day-to-day life, but they demand more and more what you call the attention. Such disease you need to identify, and by that you will be reaching beyond the existing demand. So if you want to shift from allopathic general practice, which is a symptomatic and more of the, you are treating with all those regular diseases, common disease, and if you are thinking of changing your what you call the zone, there you are supposed to create your own, means that is how the need to understand what is the demand is there outside this particular general practice, and getting the strategy sequence right. That is the fourth stage, and the fourth strategy is getting the strategy sequence right. So the four strategies: reconstruct your market boundaries, focusing on the big picture, not on the numbers. Third is reaching beyond existing demand, and fourth is getting the strategies right. Okay, I think till now it is going good. Now this is very much important point. So I request all of you to focus more. Okay. So reconstructing market boundaries is, first one is we need to finalize our niche. What do you mean niche? Niche is you need to identify one biggest problem that you can solve as per your expertise in Ayurveda. Okay. So the one biggest problem, you need to identify one biggest problem. As again, the MD Raja sir is totally focusing on anorectal disease. That is one biggest problem he is solving it with his own unique solutions. And his target customers are the patients of anorectal problem. That is how you should have your niche clarity. You need to have your niche clarity. One of my good friend, Dr. Narayan Sahane, he has got the biggest problem what he identified is the urethral stricture. And he is having his own unique solution of Uttarabasti. And his target customers are urethral stricture patients. And by that he is reaching globe. That is how you need to identify the niche. Okay, you need to identify your niche. So if you have still not identified your niche, or if, after this session, if you really feel to create your own blue ocean, sit in your clinic or wherever, observe which particular problem patients are coming to you, or the people who are not coming to you, and but in your locality, that particular problem patients are going to some experts. That can be your niche. Find a solution for that and offer it. By that, you'll be creating your own blue ocean. Second is looking across the alternative streams, like you need to look at the alternative industries. Now, alternative industry for us is allopathy medicine, naturopathy, yoga, homeopathy, acupuncture. So what those people are offering to their patients, when especially with their particular specific, their own respective medicine, I am speaking. Don't look into those people who are naturopaths but practicing allopathy medicine. Don't look into the people who are yoga specialists but they are still practicing allopathy medicine. Don't look to what the homeopathy people who are practicing allopathy medicine. No, I am speaking about the people who are practicing their medicine in which they are specialized, what they are offering to the particular problem, what you identified. If you identified one particular problem, the particular disease, and for that, what the naturopathy is offering, or the allopathy person is offering, what a homeopathy person is offering, okay, what the other people are offering, you look into that, and accordingly, you can get the ideas. You can find the opportunities where you can make an intervention with your Ayurveda medicine, or integrating the same, borrow the same thing from them also. You can copy from them, okay, feel like an artist, and club it with Ayurveda and mix it and give it. It may be integrated medical practice, or find the problem, what they are getting, means they are oftenly getting, and what are their limitations, and how you can overcome offering your particular solution, especially with Ayurveda. That is the second point. Okay. Third point is look across available options within Ayurveda. Means look if you and look inside first, we have to look into Ayurveda, what we can offer to the patients, which we can create new offer, where we can raise whatever we are offering. In that, how can we raise the value, or anything which is going wrong in our particular offering, that should be eliminated or it should be reduced, so that by that you can be making a very great value addition to the people. And what we propose is, if you are looking for a blue ocean and at a upper level, a macro niche, I'm speaking about the macro niche, micro niche. So disease identification is micro niching, and beyond means above is 7 Ayurpreneur revenue models. That is, whether you are interested to practice integrative medical practice, pure Ayurvedic practice, or you want to be getting into the health coaching, or you want to have startups, or you want to have technology or technological some what we call the startups, or you are very best in researches and you want to give research or to help to research help to the startups who are coming with their medicines. You want to do clinical trial on that, or you want to publish the books. And if you are whatever the farming, Ayurveda farming, if you are going to do. So these are the macro niches. So if you can identify these macro niches, the 7 revenue models, which within the Ayurveda, you can create your own blue ocean. Okay. Look across the chain of buyers now. Now buyers here, if you are a startup owner, if you are having some medicines to offer, products to offer, then you will be having buyers. Okay. But if you're a doctor, practicing doctor, the buyers should be considered as patients. Okay, patients. Now you need to look across the particular the problem what you identified, and the what you call the sufferers of that problem, maybe a buyer or patient, whether, and that you need to understand where which thing, or if your problem is across the globe or within your locality. So if you are dealing with a problem which is across the globe, then you can look into the pattern of the chain of international patients and international customers. Okay, and domestic also you can look into. So you need to identify your buyers and patients at two levels. One is at national level, another one is at the international level. Okay, then influencers. You need to influence the people who can influence your what you call the market, who can help you to grow. Like, you can collaborate with, or you can educate, you can convince the doctors of other system to refer the patient to you, or refer or promote your product to your customers. That is the influencer. These are the influencers. They will influence their patients. They influence their own what you call the customers, like medical representatives. They can also influence your what you call the name. You can your products. They can promote your products. They can promote your name wherever they are moving around, because they will be visiting all other system, other doctors also. They will be visiting. They will be visiting the medical shops. Okay, there also they can make your what you call the word of mouth publicity. Medical shop owners, they can also refer the patient to you, and go to Ayurveda BAMS graduates who are practicing allopathy medicine. Okay, take them in confidence, arrange a get together for them, offer them the one party, and in that you pitch your whatever you can offer, the value innovation what you have made with Ayurveda for your patients and for their patients or for their customers. So that will bring you a lot of what you call the customers to your products or services, patients for your clinic. Okay. So because see, when you are creating your own a specific niche, you will not be considered as a competitor for them, because they are not practicing that particular problem. They are not treating that particular problem. Even if they're treating, they have got the limitations. And beyond that limitation, whenever they want to look for an expert, they will send that patient to you. By that, you will not be competitor for them. And neither they are competitor for you. They can be contributor for you. And the same way, whenever you find something which you are not better, you are supposed to give them back to those people who are more expert than you. So that is a mutual, what you call the connection, communication, what you call the business connection you need to, network you need to develop. Now, fifth one is look across the complementary product and services offerings. So you can club, shamana, shodhana, parasurgical procedures. You can take the help of the dietitians, yoga, psychological consultants, educative e-books and tracker sheets you can give to your patients so that they will be learning. Because if you educate more, the patients will get more trust in you. And by that, you can add value to your particular blue ocean offering. Look across the functional, that is utility index, as well as emotional index, which should be appealing to the patients and customers. Okay. So you need to have a great ambience of your healthcare facility, emotional connectivity with patients to provide holistic relief, and acceptable and enjoyable procedures. So see, ultimately everybody want a pleasure. So if you are able to give them pleasure, okay, taking off their pain, you will be creating your blue ocean. Okay. So you need to look across the time also. So as per the relevance of the time, you need to create your own blue ocean. Okay. Whether that whatever trend is going on, accordingly, you need to come up with your own blue ocean offering. Okay, that is like, for example, post COVID, there is a surge in Ayurveda demand, isn't it? So you can see here the Ayurveda market size, which was clocked at 8.83 billion US dollar in 2021, is expected to grow to 28.23 billion US dollar by 2029 at a CAGR of 15.63. So that is a trend. The trend, upward trend is going towards Ayurveda, and we need to make use of this opportunity so that we'll be staying in the market with our unique offering, and by that long-term health benefits for the patients and relevant to the time period can be achieved. So that is the first what you call strategy, that is reconstructing your market boundaries. So bigger picture is you need to create, okay. It's not that always you need to create a low cost solution for the existing problem. Instead, what you need to do is you need to visit that particular what you call the existing problem. You need to break it down with the first principles. Go to the subtlety of that particular problem. What is the problem? Why it is happening? And whatever the available solutions are there, why, whether how much they are beneficial, how much they are not beneficial, what is the gap there? And if you are able to find out that gap, okay, with existing solutions, and if you can create a product or service which can uh, compensate or substitute that particular available what you call the offering available solutions. Okay, like for example, as I told you, Basti treatment for BPH. So if the BPH, if you are able to apply, I mean, give the what Basti treatment for the BPH, and by that, if you are able to relieve the what are the problem of the patient, as well as if you are helping them to avoid that TURP, okay, the surgical intervention, that is how you are going to what make a value innovation, and with the what you call the cost effective, because surgery can happen costly, as well as the more hospital stay, which will also add on the what you call the price, means the expenses. So you are going to challenge it, because see, our classics do not promote any surgical intervention for the mutraghata. That gives us an opportunity to challenge this present assumption. Present assumption is that BPH always requires TURP. But as per classics, it is apanavata vikriti, because of which there is a fluctuation in the size of the prostate, and that can be reduced. That can be reduced, and by that symptoms can be reduced. Okay, so this, the non-surgical Basti treatment for BPH can be a great what you call value innovation for the what you call the blue ocean creation, which will give you a big picture. Big picture is that you will become significant to the patient with by means helping them to be free from that surgery which they were fearing of. So you have taken up their fear, you have given them the comfort, what you call the best solution, and by that you are getting bigger in their what you call the image, and by that you will be making lot of money without even with a less number of patients. Okay. So reaching beyond existing, the third one is reaching beyond existing customer is you need to desegment your market by focusing on the key commonalities. So key commonalities is what? See, in the market, we have three tiers of the customers, three tiers of the what you call three tier types of the patients. The tier one patients are they are interested in Ayurveda, they are loyal to Ayurveda, and they are ready to take the Ayurveda medicine. Okay, so offer them Ayurvedic medicine and pure Ayurvedic solutions so that their loyalty can be, their trust can be built up, and they will stay with you. Tier number two, that is, they are interested, but still they are shopping here and there. They are going, they are coming to you also, they are going to allopathy medicine also, they are going to homeopathy medicine also. So there you need to engage them. Okay, you need to engage them by integrative medical practice or trying all available, and by that you need to identify their, what is their problem, what is their solution, what is their requirement. Accordingly, you can make your own particular product or service. And third is the people who are not at all aware about Ayurveda. It doesn't mean that they are not interested in Ayurveda. They are not aware of Ayurveda. So what you need to do is that you need to educate such patients who are, fortunately or unfortunately, they are in bigger number. I believe that all of you will agree with me. They are in a bigger number, huge number is there, who are not the customers of the Ayurveda, who are not the patients of the Ayurveda. That is because we have never educated them. Because 95% of our own Ayurveda graduates, they are practicing allopathy medicine. Because of that, the potentials of Ayurveda has not been offered to the common public. And because of that, the bigger community is there, which is lying, which is in, and that is the biggest market what you can capitalize on with educating them with your social media posts or your seminars or your webinars or your workshops or your educative, what you call the pamphlets. By that, see, ultimately all the three tier patients, they want remedy for their problem. And if you are going to give that remedy for their problem with a differentiation, with a value addition and cost reduction, okay, less in the pain, then it is, you are looking for the what the customers who are not into, what you call, earlier they are not into your particular market, they are beyond your market, okay, what you are catering. So then the fourth strategy is, you need to have, okay, you need to create, uh, you need to keep that strategy right into the place, right into the place. Okay, so I believe that I'm going fast, but if you are focused, laser focused, you will be getting my points, because I want to wind it off within the stipulated period. I'm trying to do this. Okay, so I believe that you people are focusing and you'll be understanding these things. Of course, I am very much fast, I know, but still, I don't want to spoil your Sunday. I don't want to take out the extra time. That's why I'm doing it. Okay. Anyway, so when you want to keep the strategy right, the strategy is, you need not be first to be in the market, because already Ayurveda is existing. So don't think that no, already Ayurveda is existing, but still no other people have not done. Why? How can I do? Don't underestimate yourself. It is the it is not that it is not that what matters is that you should be first in the market. It is rather it matter, what matters is you need to link that value to your innovation. So innovation and value, if you are able to link them to give a better offer to your patients, you can make it. For example, as I was telling, Dr. Narayan Sahani, one of my good friend, he has got his own, what you call, the website, and that is called as www.cureurethral So urethral structure is existing. All the allopathy medicines are, all the allopathic urologists are there existing. Urethral structure is existing. Okay, isn't it? It is existing in the market. But he could identify that he can add value to those patients with using unique Ayurvedic treatment. And by that he became, what you call, the first to add value from the Ayurveda. Okay, even though in the market a good number of urologists were available. Okay, so urethral structure was also existing. Urologists were existing. They were doing surgeries. They were doing dilatation of the urethra. But what the Dr. Narayan Sahane could do is, he could introduce Uttarabasti along with his particular, what you call, the dilatation. And that made him to make it second strategic point, that is strategic pricing. It has helped him to make his strategic pricing of his particular therapy. He charges 1,50,000 rupees for 21 days package of Uttar Basti and dilatation. That is the strategic pricing. Who says that people are not going to pay? People are paying him, because he has removed the surgery, fear of the surgery. And second is, the recurrence rate is less and better relief, because there is no complication of surgery. Post-surgical complications are not there. He's removed that even post-surgical complications also. And for that, and 21 days, people are not fearing to undergo that particular Uttarabasti. Okay, because of that, they are able to pay him 1,50,000 rupees for 21 days treatment. That is how the strategic pricing should be done. Okay, and third, what you need to keep it right is, okay, you need to identify your blue ocean idea, its index, whether it is proper or not, by understanding utility, what you're offering is, it is getting better, it has got better utility or not, it has got a proper pricing or not, and it is cost effective or not for you people, for you, and adoption, how better it is adopted by the patients. That is how you need to put it. You need to evaluate your what you call a blue ocean index. And the fourth one is, that is 3 characteristics of good strategies. You need to focus. You need to focus across all the key factors of the competitors. What the competitors are doing, you need to be updated with that. Focus on that. Accordingly, you can change your offerings in the blue ocean. Okay, you can change the offerings in the blue ocean, and you need to be different from them. That is called divergence. You need to be different from your competitors. Okay, you need, because you, by 3 P's, you can be different from your competitors. The 3 P's, that is Ayurveda principles. First P is Ayurveda principles, Ayurveda products, and Ayurveda procedures. So you need not to bother much. You need to identify a problem, and your solution should be ready using Ayurveda principles, Ayurveda products, and Ayurveda procedures. The 3 P's will help you to stand out of the market, different from your competitors. Okay, so that you will not be getting into that red ocean where you are forced to what you call compete with the people with in getting trapped into that value cost trade-off, and investing more to upgrade your particular skills or the equipments and procedures. Okay, so that all those things can be taken out. And third is a compelling tagline to make your particular profile very clear. What you are offering, that the what you call USP, your USP should be there, or your compelling tagline should be there. So better, easiest for us is, Ayurveda doctors is non-surgical if you are if you are not Ayurvedic surgeon, non-surgical, non-chemical because it's organic, all the Ayurveda drugs what you are using, no side effects. Already people are having this in their brain that allopathic medicines are having side effects, and Ayurvedic medicines are not having side effects. That you make use. Natural remedies, isn't it? That the tagline is natural remedies. Get healed naturally. But tagline sounds very great, isn't it? So you need to understand these 3 things. Focus on your competitors, be different from them, and have a very compelling tagline which you can attract your patients and your customers. So that is how you need to keep your strategy right into the place. Okay, right into the place. Now, what are the outcomes? I'll take another 5 minutes, and the thing that I believe that I will complete it. So outcomes are, you will be able to creating your own uncontested marketplace, okay, making your competition irrelevant, okay, and by that you will be creating and capturing new demand for yourself and for your offerings, for your solutions, for your what you call it treatments. Thus, you will be breaking the value cost trade-off. You need not worry about what price or the other people are charging. You can have your own value cost for your products and your services, and you will be, the greater thing is, you will be aligning Ayurveda system in the pursuit of differentiation and low cost. So you'll be doing great job. You'll be offering Ayurveda what you call remedies for the patients, for the public, which will help you to be free from that stress, legal phobia. You'll be able to have the acquisition of the global significance, financial abundance, and the biggest thing is, you will have time freedom. You will have time freedom. And the conclusion, coming to the conclusion, let me close the upper one. Okay, the conclusion number 1 is, yes, conclusion number 1 is, blue ocean strategy is nothing that you need to look into, means outside your domain. It is not that you need to have, means something new you need to learn. It's creating within you, within your system, within your core business. See, we are all Ayurveda graduates. That is our core, what you call the in area. Ayurveda is our core area. So if we are able to create the value innovation in that our own Ayurveda, which is not beyond our knowledge. Ayurveda, all of us, we know basic Ayurveda. And we are able, if you are able to create the something, means the better value innovation through that particular your core, what you call the learning or core domain, you will be eating red ocean. You will be coming out of that red ocean. You will come beyond that red ocean, which I call an allopathic medical practice. Okay, we can have our own blue ocean, which because we are creating from our own, within our Ayurveda. So we think our own product or service from Ayurveda for one problem, one solution. Be specific. Don't be general. See, if you are serving everyone, it means you are serving none. You are serving none. We need to be specific because specific is terrific. Okay, and explore the non-customers. Conclusion number 2 is explore the non-customers. As I told you, tier 1, tier 2, tier 3. Tier 1, already they are interested in Ayurveda. They are with us. They are having trust in Ayurveda. Tier 2 is they are aware of Ayurveda, but still they are not into our zone. Tier 3 are they are not at all aware of Ayurveda, and that unfortunately that is the biggest market that you need to look for. Okay. Third conclusion is blue ocean strategy is minimizing the risks and maximizing the profit by 3 levers. Okay, by 3 levers. So that is strategic pricing. Okay, your pricing should be proper. Then target profit. Okay, profit should be targeted, and that should, and target cost. Cost should be low, profit will be more, and pricing. By that you can have strategic pricing, and by that you can get good customers, loyal customers, what you call rich customers, quality customers for your particular offering. And fourth conclusion is value without innovation. This is very much important. Value without innovation will not make you stand out in marketplace. You may be having a good number of all the equipments in your hospital. Whichever is new has come to the market, you are going to use it. But if you do not add value along with that innovation, you will not stand, because you are one among those, the same laparoscopic surgeon. You'll be one among the same, what you call general surgeon. You'll be one among the same, what you call, allopathy physician, or if you are conducting what you call, if you are running what you call the intensive care unit on the grounds of on the parameters of the allopathic medicine, you are not standing out of the market because already your competitors are there. They are doing the same thing. But when you do innovation, and the innovation without value also will not get you the buyers. Innovation without value will not get you the buyers. So you need to club both. Value innovation should be value innovation, not technology innovation. It is value innovation. Okay, because the patients are ready to give you when they get the value, and it is offered in a more innovative way. Okay, so we need to look, we need to create, we need to look to for creating our own blue ocean because of these 4 reasons. One is a rising call for creative new solutions are happening. Whole market is looking towards you, man. Okay, all of us, we are supposed to make use of this one. The global market size, which is expected to grow at the CAGR of 11.2% by 2028, it will be crossing, it will be clocking $348 billion US across the globe. So we need to look, we need to answer for this. We should be ready for this call, a rising call, okay, for Ayurveda. Then the rising influence and use of public megaphones. See, social media also bombarding. Now the social media is also coming with all the, especially post-COVID, the social media, many of the Ayurveda remedies have been promoted by the even general public and celebrities. Like, for example, the Navjot Singh Sidhu had added value to Ayurveda remedies by telling in the social media, in the TV platform, that his wife could come out of cancer using Ayurvedic remedies, home remedies. along with, of course, integrative medical, what you call integrative medicines, whatever, the treatment which was offered to them, especially allopathy medicine, the chemotherapy was done, radiotherapy was done, surgery was also done, but still the speedy recovery was by the home remedies or Ayurvedic medicines, what he has proposed, and that has created a lot of buzz, isn't it? Lot of buzz. So the already there is the trend is going on. The whole social media influencers are promoting organic and Ayurvedic remedies, and of course, government of India has also taken up the initiation. Desha Prakriti, this movement was started because that people have come to know many of the things, means the Ayurveda exists and Ayurveda has got a different perspective, and that we need to make use. And that for that we need to create our own blue ocean, because the people are getting awareness. The third reason why we need to look for creating our own Ayurvedic blue ocean is there is a locational shift is there, which is creating a future demand and growth. Okay, so whole Western world is looking towards alternative medicines. See, you can see the whole green patches, what you're seeing, all the nations which are with the green, what you call the patches, they have all said yes to traditional and complementary medicine. So whole globe is looking towards what you call Ayurveda, or alternative medicine rather, and we need to, the location shift is there. The other countries are also looking for Ayurveda experts, Ayurveda medicine, Ayurveda remedies, Ayurveda products, Ayurveda services. So we need to, for that, we need to create our own blue ocean, and we should present or brand ourselves as an Ayurveda experts. Okay. And there is a rising speed and easiness of becoming global player. So now it has become very easy to reach the globe by online platforms. You can have your own online consultation. By that, you can reach the global market. Okay. One of my friend, Dr. Nandini, she has practiced what you call the allopathic medicine for the 10 earlier in the initial phase of period of her 15 years of career, and then she shifted to what you call the infertility as an infertility specialist using integrative approach. And recently she started with her online what consultation, and she is getting patients across the globe. That is how she has created her own blue ocean. She has created her own blue ocean as a infertility, what you call the holistic infertility expert, where she is offering all the Ayurvedic medicines, Ayurvedic procedures, yoga, diet, and even some the in what proper integration of the allopathic or modern investigations. Okay, so that is how we need to create our own blue ocean. And I would like to acknowledge this book. I read this book, a very great book, which has given me a lot of insights. The Blue Ocean Strategy by W. Chan Kim and Reni Morgi. So what I could read for the last 10-15 days, I tried to concise it within 45 minutes. And I believe that it has reduced your efforts of reading this book. Or I recommend that you need to go through this book, but still you have got all the gist of this book in this particular presentation. And by that, I believe that your Sunday has got some meaning, and I believe that I have added value to your particular day. Okay. So thank you for being here till the end. Of course, 15 minutes, 12 minutes I am exceeded, but still I would like to have words from some of the presenters here. I'll select one or two so that MD Praja sir, I'll be making you co-host. Okay. Promote to, let me help you, allow to talk. See, sir, whether you can unmute yourself and give your insights on.
Yeah, able to hear me?
Yes, sir. Yes, sir. Very clear and
Yeah.
loud, and Happy New Year. Okay.
Thank you. Happy Sunday also.
If it is possible, if you can make your video on so that I can take a click, so that if it is possible. Okay, if you do not have
Video,
any problem. Okay,
no problem.
maybe video may not let me make you co-host, promote panelist, then only you'll be able to make. Okay, now can you see, sir?
Join us panelist. Join us panelist. Yes.
Okay, now you can see whether you can put your video on. Yes.
Okay. Yeah.
Yes, sir. Yes, sir. Good morning. Good
Good
morning.
morning. Good morning.
Leisure time Sunday.
Yeah. As you said, actually, this whole session,
Yes, sir.
it belongs to me.
Yeah.
because I, sta- I started my career as a general practitioner.
Okay.
So yeah, general practitioner, and 17 years I worked as a general practitioner and on part-time anorectal surgeon. So I used to do all the things. I used to do Agni Karma, I used to do Vasti, I used to do treat fevers and everything. And 2015, I suddenly decided not to touch any other things other than anorectal. So I started Hitam. So previously, I used to work from morning 8 o'clock to afternoon 2, and again evening 5 to almost 10 and 11.
Yes, sir.
So by the time I stopped my general practice, I used to get around 70 OP, and I used to get around 4 lakhs per month. So it's a tough thing when I wanted to shift, but after shifting, total revenue is 10 lakhs, and
Wow.
this 10 years we got all the data and we calculated, and by the end of 2014 December 31st we crossed 14.5 crores.
Wow. That is the magic of creating your own blue ocean, sir. Being role
Yes, yes,
specific.
yes, yes,
Yes.
yes. So so previously I used to call a physician, I used to call a cardiologist, sir, I'm referring a case. Now I am getting calls from urologists, they are referring a case.
Yes, sir.
And one of the senior most surgeon, who is the superintendent of government hospital, he used to
Yes, sir.
refer all the fistula cases to me. And
Okay.
many of the gynecologists, many of the pediatricians, they are getting treatment from me. So now I'm working from morning 6:30 to 3 o'clock. And after 3
Okay.
o'clock, I'm investing on myself, physical exercises and a little academic work and relaxing. And by 9 o'clock, my total day will be over. I'll go to
Oh,
bed.
so you are living
So
a very good, abundant lifestyle.
yes, definitely. The thing is, it is not only in Madhya Pradesh, even in
Yes, sir.
Telangana, Medical Council has given instructions not to take Ayurvedic doctors as duty doctors.
Yes, sir.
And now more medical colleges are coming. A
Yes, sir.
urologist working for 2 lakh rupees, 2
Yes,
lakh
sir.
rupees per month.
Yes, sir.
But I saw a Panchakarma specialist in my area who bought a flat for 8 crore rupees.
Oh,
So definitely, whatever the point you mentioned, it is of worth. So I feel like suppose if Vivek I, session is before some 15 years, I may be still ahead.
yes. Yeah, thank you, sir, for that great words. Okay.
Thank you. Great session.
Yes,
Actually,
sir. Thank you, sir. Thank you, sir.
yeah.
Thank you,
Okay.
sir. Have a great
Okay.
day. Yes,
Yeah.
sir.
Thank you.
Yes, sir.
Bye.
Yes, sir. Bye. डॉक्टर प्रियदर्शनी आप बात करना चाहते हैं तो आई हैव मेड यू आई मीन allowed you to unmute yourself if you want to express your opinion because you are also a Ayurvedic practitioner since beginning. Priyadarshini, Dr. Priyadarshini, can you speak? Okay, we have got another two. I can have another one or two. Dr. Smita, whether if you are ready to speak, I'll allow you to talk. You can put in you can raise your hand or you can put in the chat box. Dr. Smita, yes. Yes, Dr. Smita, I allowed you to talk. You can unmute.
Yes. Good morning, Dr. Vivekanand. It was really a very
Yes.
insightful session. And
Yes, ma'am.
just the things I can add, as we both belong to Shalya the stream. So
Yeah.
many times it is seen that we get patients who just don't want to go for surgery, and that's why they come to us.
Yes.
And in that case, Dr. Sahane, likewise, right now we saw Dr. Rao. So they are the stalwarts of Ayurvedic surgery, we can say, because
Yes.
many times it is seen that uh, the parasurgical procedures, so they are doing wonders. And in new MSR also, we have got separate departments and all the infrastructure needed for parasurgical. Means the world has recognized parasurgical procedures from Ayurveda for
Yes.
we cannot say curing, but at least limiting the progress or the symptoms of
Yes.
surgical cases. So
Yes.
in that case, certainly we can just as Ayurvedic practitioners, surgery practice, we should keep in mind that what you rightly said in this session, that we should find our own value, and accordingly we should charge the patients. And this habit we have to inculcate in ourselves,
Yes. Yes.
because we are means we should come out of the inferiority.
Yeah.
And
Undervalue. We
that is the
undervalue
main thing.
ourselves. We undervalue
Yes,
ourselves.
that's what.
Yes.
And means I'm really means I have heard many sessions of Dr. Sahane, and rather I have started practicing it in my own practice, and certainly they're showing the miracles.
Yes.
So
Yes.
attending such CMEs and such sessions, so they certainly add value to our practices. And new generation, actually, they should certainly inculcate these practices and switch totally to Ayurveda. And thanks to
Yes.
Mr. Modi, Prime Minister, because this Ayush Minister
Yes.
and this sections of government, so they are giving us full like liberty. So we should
Yes.
cash it, and we should go ahead. So it was
Yes. Yes.
really a
That's it.
very insightful session, and I just look forward for more such sessions. Thank you, thank you.
Yeah, definitely. Definitely. That's it. That is what my mission is. That's why I founded this Ayurpreneur Lifestyle Hub. I want to build this particular community where all such people like you who are practicing and they have like MD Raja sir and all those stalwarts as well as the people who can join together and we can create a particular movement where our next generation will be more confident to come into this particular what you call the blue oceans, and they can be so creating a vibrant community where we will be mutually helping each other, and by that we can create our own vibrant community and more abundant community where we need not to bother for any competition as well as any particular scarcity. So that is my this one. So Dr. Smita, I believe that you are from Maharashtra.
Yes,
Which
I'm
place?
from Pune.
Okay, okay. So if you're a teacher, I request you to share this particular my community among your students and encourage them to get a free membership to at least Ayurpreneur Academy. And Ayurpreneur Lifestyle Hub is a paid membership for lifetime where different courses are offered to them as a free of cost. So I request all of you to promote my community, and you people be a part of this community so that once we are in the, I request all of you to join this particular movement which I have started, and it is not one man, it cannot be possible by one single person. All the people like you, if you join together, we can create a particular community and we can drive this particular movement, take this movement to the level within next 2 3 years. The Ayurveda surgeon should be Ayurveda doctor should be everywhere. Let it be life coaching, let it be health coaching, let it be other sort of things which are already online there. Many of the people are coming, non-medicals are making use of Ayurveda. So thank you, Dr. Smita, for your all that opinions, feedbacks as well as suggestions. And if Priyadashini would like to speak, you can raise your hand. I can make you to speak. And Om Prakash Dave sir, good morning. And I think sir was not there in the session. I think he had joined now. So Priya, would you like to speak? Priya, बात करना चाहेंगी आप? Because Priyadashini is a pure Ayurveda practitioner. She is my classmate, and I see her last 25 plus years she's practicing Ayurveda, and her words will mean a lot for the session. Okay, maybe she may not be there. Okay.
Hello.
Yeah, Priya.
Namaste, namaste.
Namaste, namaste.
Hello, Vivek. How are you,
Priya,
sir?
हाँ,
um,
आप कुछ बोलना चाहेंगे तो
आज 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 या डेफिनेटली सर। आज
हम्म,
थोड़ा मैं लेट ज्वाइन हुई, लेकिन
हम्म,
अच्छा था सेशन, और क्या माइंड ओपनिंग था। रोज रोज थोड़ा तो पॉलिश करना ही पड़ता है, कुछ नहीं कर सकते हम आयुर्वेद वालों को, जो इतने दिनों से नॉर्मल प्रैक्टिस कर रहे हैं ना, ये तो है। और
yes, yes,
आज ना मैं अपने बारे में ही थोड़ा बोल देना चाहती हूँ।
yes, yes, yes,
मैं माइग्रेन के बाद इसमें ट्रीट कर रही हूँ, और ये मेरा 27 ईयर्स से एक्सपीरियंस है। जब मैं कॉलेज में थी तब से मैं ट्रीट कर रही हूँ। हाँ, एक
very good.
पर्टिकुलर केस था। एक्चुअली मेरे पापा मम्मी भी प्रोफेसर्स हैं, डॉक्टर्स हैं, और आयुर्वेद डॉक्टर्स हैं, और उनका एक केस था जो मैं फाइनल ईयर में थी तब मुझे दिया गया था कि चलो ये देख लो क्या है कह के। तो एट दैट टाइम ये मुझे माइग्रेन थोड़ा फैसिनेटिंग लगा, और उसमें जो रिजल्ट्स आए, एंड वो भी लॉन्ग लास्टिंग नहीं, लाइफ लॉन्ग के लिए जो सोल्यूशन मिला ना उस लड़की से, एंड इट इंस्पायर्ड मी।
yes,
और तब से मैं कर रही हूँ, और आजकल भी मैं माइग्रेन पे ही काम कर रही हूँ, और रिजल्ट्स भी बहुत अच्छे हैं। और पंचकर्मा ओरिएंटेड ही रहते हैं, पहले शोधन करके ही नशे करते हैं, और नशे में जो मेडिसिन वात के लिए अलग है, पित्त के लिए अलग है, और कफ के लिए अलग है। तो इन बाइफर्केशंस में रिजल्ट्स 100% मिल रहे हैं। और साथ ही में उनके जो साइड प्रॉब्लम्स थे, जैसे सर्वाइकल का प्रॉब्लम है, या कुछ और भी प्रॉब्लम है जो वात व्याधि के अंदर आते हैं ना, वो सारे भी अच्छे रिजल्ट्स आ जाते हैं।
वेरी गुड। तो
तो
वही है,
अभी
बहुत
अभी
सारे
अभी तो मेरा चल रहा है, लेकिन
यस,
मुझे पता है कि अच्छा रिजल्ट्स आएगा, और मैं भी वेरी नोन पर्सन होंगी।
डेफिनेटली दैट इज व्हाट हमारे पास आप सभी लोग इतने वैल्यूएबल होने के बावजूद भी वी आर नॉट ब्रांडिंग, हम ऑफरिंग जो है ना
या
बियॉन्ड द
हाँ,
टेरिटरी देना
नहीं,
चाहिए।
अभी मुझे ना उसका इम्पोर्टेंस बहुत पता चल रहा है,
यस,
जो आप
सो
कर रहे हो, और कैसे हमें ब्रांड करना है, जैसे जिस चीज के लिए आप इनिशिएट कर रहे हो, कैसे करो कैसे करो, वो स्पार्क लगने में थोड़ा देर लग रहा है, लेकिन लगेगा जरूर।
नहीं, डेफिनेटली। ओके, ऑल द बेस्ट प्रिया। ओम
थैंक यू सर,
प्रकाश
थैंक यू।
ओम प्रकाश सर, वुड यू लाइक टू स्पीक? ओम प्रकाश सर, लास्ट बट नॉट लिस्ट सर, आपका कुछ, आप बहुत कुछ बोलना चाहेंगे ओम प्रकाश सर? I have made it to, I have permitted you to unmute. Okay, maybe sir. Yes, sir.
सर सर रियली ये बहुत बड़ा आपका कंट्रीब्यूशन है आयुर्वेद की साइंस को सर, रियली ग्रेट। ये जो प्लेटफॉर्म आपने बनाया है ना सर, सारे
Yes, sir.
सारे एक्सपीरियंस्ड पर्संस को आपने एक साथ में शेयरिंग करके नई जनरेशन को जो आप एनलाइटन कर रहे हैं, रियली ग्रेट ग्रेट
Yes,
सर। और आज
yes,
का
sir.
सेशन,
Thank you.
पिछले सारे सेशन सब के सब उस माला के अच्छे मोती है, रियली थैंक यू वेरी मच।
Yes, sir. Thank you, sir. Thank you. Okay, then
थैंक यू।
thank you all of you, and of course I cannot bring all of them to talk. Anyway, the people who could express, I believe that it is opinion of the majority of the participants who have listened to this. And if you are watching on YouTube, I believe that this will give you a lot of value. It add value, and I believe that you will be the part of this movement, and will be the members of Ayurpreneur Lifestyle Hub, which is offered at a very minimal cost, but the more value innovation is there. So I request all of you, okay, and be, and if you want part of this movement, I request you to go to my website, Ayurpreneur Lifestyle Hub. Okay, and you can buy their Ayurpreneur Silver membership, which will be a lifetime membership for being a part of Ayurpreneur Lifestyle Hub. So Ayurpreneur Lifestyle Hub community members, once you become, you will get the courses, pre-recorded courses, and such weekly webinars, which may be even addressed by many of the stalwarts I'll be bringing in from different domain also, even from the business coaching, from personal, physical, what you call the life coaching, life accounting, finance, legal people, experts, so Ayurveda experts, and all those people will be brought into, so that a holistic approach can be given to our Ayurveda professionals to develop their own, what you call the Ayurpreneurship, what I call, what other name I coined, Ayurpreneur. Ayurpreneurship, the Ayurveda and entrepreneurship clubbing together. That is what I coined, and that word will really resonate in the coming days in the world. So thank you all of you for sparing your Sunday with me, and thank you, and we'll see next Sunday. And I request all of you to promote this, bring more and more people to this particular session, so that when we attract when we build a big tribe of the same the people who are vibrating the same frequency, we can create wonders. So with that particular belief, I I'll sign off from this session and see you in the next Sunday. That is Sam's. That is Sunday Ayurveda Mastermind sessions with the maybe me or some a guest will be appearing on the next week. Okay. See you all. Have a great day.